Rise for the pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Had a chance to review the minutes?
So approved.
Motion, second.
Second.
All in favor?
Aye.
Thank you. Resolution 1.
Yeah. This is the money for vaccination from state for vaccination and no? Okay, yeah. Because my finance people behind me, if I say something wrong, they will immediately know. That's why I need to look at them.
That's fine. I learned early in my career. Good backup people. You don't have to apologize too long.
That's the right info. That's the wrong resolution.
Moving second for discussion.
Yes, Doc, where do we sit on vaccinations? Not one, 2 vaccinations in this county, do you know?
In my slides I will show you.
That?
Yeah.
Okay, that's good.
It's in the slide.
Okay.
Yeah.
Yeah, so I just noticed that the info memo is correct. The resolution is not on this particular one.
Okay, what do we need,
What's the correction?
what do we need to change in the resolution?
The body of the resolution is actually the ELC Enhanced Detection Resolution. So the info memo is correct.
Okay.
You need to send in the
Yes, and I
resolution
know
has the correct
I had sent the
dollars on
corrected
it.
one, right?
So we did,
Yeah. No, the info memo is right, the resolution.
So it's a copy of the resolution, that's number 2 there, HS2, HE2 rather.
The body
Oh,
is
the
the same.
The same.
Yeah, the
Right.
first, the second, and the same.
Yeah. And I know I had said a corrected one to Chanel at one point, but I don't, are you Chanel? It didn't make it in there, so you should have it. If you can't find it, let me know.
So the body itself in HE1 is the body for HE2.
Mm-hmm.
Okay, so just the bodies itself.
Yes.
We switched. Okay.
So, does everybody have a copy of what each?
Do you have a
I would
copy?
have to
I do not have a
edit and
copy.
Make it. And
It
then
might still be in your email, the original.
the original. Let me
Yeah.
go look real quick.
So you could skip this and come back to
All
it.
right, we'll
Give
come
her
back.
time to go print some copies.
I'll be right back.
They're the same, HE1, HE2.
It's mine that's recorded.
She's
What I
recording.
do with my phone, maybe I can.
All right, so let's move to HE2 because that one is correct.
Yeah, this is ELC grant and ELC for case investigation and for testing, and this is money we needed to accept to keep our this we have part-time temporary case investigators. So this is the money we got.
Have a motion?
Motion?
Second. Any discussion?
I'm sorry, just one word. Can we do this without her here taking records?
Yeah, I just said
She's recording.
Okay,
Yes, she's
recording.
recording.
Okay. All in favor?
Aye.
Opposed? Motion carries. HE3?
H3 is a contractor for hospice service, and these drugs and these pharmacies. And I look at it like Wayne, yes, work with us for a long time, and this Vera is here, and the credit really should give to Vera, and over the past several years, and she's the leader before she became a director of patient services. She was director of hospice program, and under her leadership, and reduced a lot. So this contract helped to control the cost. Anything, Vera, you want to add on?
No, we did an analysis of who would be the best vendor. When the RFP went out, we did choose through the 3 of them, and we've decided that Wayne's is really our best option. They do twice-a-day delivery. They will make deliveries to home. Jamie at Wayne's has made himself available 24 hours a day. If overnight, if we need an emergency med, he'll open the pharmacy. We're not going to get that from any of the other pharmacies, so we'd like to stay with Wayne's. And the cost.
Need a motion for discussion?
So made.
Second. Any comments or discussion?
Well, I think it's important that, number one, we get the service we get from them, and also it's our local people. I
Absolutely.
mean, they live in our backyard.
Absolutely.
So, I'm all for it.
Thank you.
Okay. Any other further discussion? All in favor?
Aye.
Opposed? Motion carries.
Thank you.
Not in my backyard, I still have 4 inches of water.
You want to live there?
Never. In the 30-some years we've been there, seen that much water. Ever.
COVID probably caused it.
COVID caused it. Ouch. Are we good, or should we go on to the next one?
I do apologize. I just want to make sure it's proper.
We can go on to 4. Why don't you do 4?
Okay, number 4 is related to our team presented last week, Tuesday night, I think, and we talk about in our presentation. We said yes, why we need restructure, and where's the money for restructure, and where's the people help to beef up the health department for the future pandemic or even regular daily events. So this is the grant from the state, and the state build up a call, New York State Public Health call, and each county gets some money training, and this is the 2 years funding, and for Oswego County, 2 years, and each year train up to 12 trainees, and after their training, and they can find a public health job in the county or other places. So this is the funding, fully funded salary, benefits there, and furniture, equipment, all included.
So I have a motion for discussion?
Second. Okay, yeah, I just have a question. Sounds like a great program, but from what you're saying, we can train these people and they can move on to another county, right?
Yeah.
So they could just, there's no obligation for them to stay with us at any point.
But as we presented a week ago, and we will try to keep them stay here. And we already work with, just before this meeting, we had a meeting with HR and set up our internal structure, and when they finish training, and they can fall back to their job, and keep local people local.
Yeah, I want to point out on this, we can't force people to stay with us. The only way we can get people to stay with you is treat them fair, firm, and pay them.
Well,
And that's the bottom line.
I agree.
And we keep dancing around. It doesn't matter what committee or where the hell else I go, and I've gone on all of them. That subject just keeps reoccurring and reoccurring. It's like a septic tank, and all the crap comes to the top. It's the same discussion. But we have an obligation to the people you serve. Certain people elected you in your district, just like mine and all the rest of us, to offer them the services. And that's what we got to do.
Yeah, go ahead.
No, I agree with what you're saying, but we also have a major obligation to keep from being taxed out of their homes, which is what's going on in this county and across the state. And I think you can agree with that. So we have to be responsible with what we're doing.
Right, but
I agree that people need
how are other counties around us doing it, and we're losing people to them?
more population, I guess.
Kingwood County doesn't have more population,
I don't know.
almost half.
Research it, let us know, Rich, and we'll see if we can follow suit. That's all I can tell you. But,
Well, the bottom line is, that, and I'm not arguing with you, is it's just, you've been around, I've heard you talk about it.
I agree with you.
We're
but,
not paying
you know,
people, that's the problem.
I agree 100%.
I can't stand it, I don't want my taxes to go up, I get taxed enough now. But the point is, I still have an obligation on the other side of the fence, not only as a property owner, but as a legislator, to provide good, solid services to the people. That's my job, within a good cost. I don't know what's going around outside. I mean, I know a lot about Onondaga County because I'm own property there. Tax not quite as high either. So I don't get it.
You two do not have opposing views. We're pointing this out, okay?
No, we don't.
You're actually
We
agreeing
agree.
with each other.
Yeah.
So, your turn.
Thank you. I'm gonna go back to the resolution at hand. The up to 12 fellows per year. Do we get to, or do we hire them, or is the state that's hiring these fellows? Because I read a little bit about the public health corps, and it seemed like the state hires them,
No,
and they come here. Is that accurate?
No, it's not. It's not. And they apply to state. The state have an online application.
Yeah.
And the state gave us money. This is $1.8 million for 2 years, and the county hires them.
Okay, so this comes from the county, but they apply through the state. Does
Yeah.
the state get to choose?
No,
The location get to go, or you can get to choose the-
We get to choose.
Okay.
They send us candidates, but we get
They send you the candidates that are available. Got it.
Give you a list, and you pick from the list.
That's correct.
or we get local people also.
Right, and that was my point. You know.
Anything else? Good discussion.
Now, this grant is really incorporated in the restructuring because we filled out a survey for the Public Health Corps long ago with the state of what our needs are. And this information helped us develop our restructuring plan.
Okay.
Okay.
So are you saying if the county didn't go along with the reconstruction plan, this grant would be here?
It would be difficult to do this grant.
So we'd have to do the reconstruction that you want done in order for this to apply.
Would that impact us passing this today then? If we have to,
Wow.
we haven't made a decision on that yet.
I know you could still do this, just we wouldn't have positions for them available at the county level.
So
They could go elsewhere.
Well,
So we're training a bunch of candidates to work in other, that's correct.
But
I
you have
just wanna
current
make-
positions now without even restructuring that have to be filled. Correct?
We have some position. Yes, some position.
But you can't fill with this money. Is that?
No, we cannot fill this with this money because this is training money. It's not for working for the
Yeah, but I'm
county.
saying when you're done training,
Yeah,
you have
the
openings,
training
you don't
can
have to
come
be restructuring the openings or any openings you have that they would be eligible to apply for that.
Yeah, those positions that we fill with fellows would be paid for out of the grant for 2
Right,
years.
okay. Right. No, I don't think that hinges on,
It doesn't.
okay.
Okay, I just want to make that clear.
You're a good sales lady.
It makes it very difficult, but it doesn't hinge on it. And
Right.
okay.
Okay. Any other questions? Vote as you please.
I'll vote for it.
All in favor?
Aye.
Opposed? Step one. Okay. We still have to go back to one. The info resolution part did not match
Well,
the info memo.
gotcha.
So,
Yeah, that's it.
Want copies?
yeah, let's do this so
I just
everybody.
wanted to make sure I got them all.
Jim, do I need to withdraw my initial motion?
On one,
No, we're just changing it by, to match the definition.
You can withdraw if you change your mind.
No, I'm good with it.
Or if you feel good about it, I don't care.
We had the right figure.
Yeah.
But
This
this is,
is the copy and paste.
Yeah. everything is right.
Ralphie, how are you? Where were we?
Mark, how are you? You sure? Because you don't look so sure. I think we work at the same place. That could have something to do with it.
Well, I haven't been in that building in a year.
God bless you.
At least a year.
I'll trade you.
I'm working in my basement. Campus is still there.
So far.
You were your daughter doing last time too? Jesus Christ, what do you work around the clock?
No.
You're not right line as a policeman anymore, are you?
No. Those days are over.
Yeah, I got secretary to go.
I enjoyed it while it lasted.
Not hard when you go on the line for, at the range when you wear bifocals. Wow, shoot. Young guys don't understand that.
Actually, we should grind the house all the time. With the farm, so
Yeah.
my son and I go out.
I got the lineless, so it's a lot easier.
Yeah. So I'm still pretty good. I still pass. You know.
I never was real good. I like the shotgun better and the rifle. That I'm pretty confident with.
You know, we shot it.
We got guys that shoot. Oh God. Every time, and then somebody was a poor shooter like me. They reach over and shoot it in the white on his target, and then he'd go out and be one out there. What's this here?
I would do that to my guys next to me. Do a few rounds on the south side. Say, hey, look, I got target already.
Some guys had a hole like that.
Oh, yeah.
They boxed and put those guys in the shooting.
It's really impressive to see a guy who can just be that steady.
My brother heard it. Same thing.
So as soon as they get licenses, we can have more people do it. We're just waiting on those licenses. You know, let's hold on until we get the licenses and see what the cost is on that. You know, I'm not sure, because there's different levels of things. So Matt's working with Supervisor, not smart, to figure out what we need and how much we want. So, yeah, there was some back and forth yesterday, so hopefully by the end of the week we'll have something. Yeah, but all that backup is pretty much all done, so we should be done with all the backup this week. Yeah, all the stuff that environmental was helping with, and then just data entry.
Come on. But, you know, it's funny, but we really should sit down. We have a plan for your job security, because certainly part-time legislators are not going to have the dollars that we have to carry on. Should you decide to retire?
Yeah, I've ordered it.
You have to do it at least a 5-year notice. And then
Well, you know, we were asking the doctor about his plan of transition.
You can make sure the legislators can.
So generally,
Yeah.
what happens is,
Thank you very much.
I have a.
unless there's a catastrophe, the person has several months.
Oh, sorry.
Oh, you're fine.
Yeah, and
You find that
then you do a search and what?
You find that would be enough? A couple of months?
Several.
The backup plans in almost every department, that's what we got rid of years ago.
I'll take one, thank you.
There's deputies everywhere.
I can go thank you, Robbie, I just, I have one short for you. Okay.
And they got rid of all the middle management. And that was,
You want this one? No, I mean.
that was a backup plan to everybody.
I got it. I already have it printed, I just don't have to.
Okay, we can go back to AT1 to refresh everyone, Doc, and let you start all over with the right information.
Okay, this is the money for the epidemiology and laboratory capacity, and we use this money to hire temporary part-time case investigators.
That's the wrong one. Should check. This is the COVID vaccination one.
Oh, COVID vaccination, sorry. Yeah.
You just trying to slide stuff in
because you handed to me this one. This is money for COVID vaccination, and we spend this money for our clinic and additional hours, overtime, and supplies all come from this grant.
Motion, please? Oh, we got one.
I'll remake the motion.
Okay, discussion.
Yeah, I just have a simple question. The vaccines, how often are these going out now? I mean, the push is over, or what's going on? The kids are getting it done now, and where are we at with this?
In slides, and I can briefly say yes. We 9 school districts in the county, and we collaborate with Connect Care, and they have 4 school district have this school-based health center, and 1 school district physician is their doctor. So they cover 5 school districts, and we cover 4 school districts. And before Christmas, all 4 school districts first dose for 5 to 11 years we already delivered. So it's underway.
It's still ongoing.
Yeah, it's still ongoing. Second dose will be, I think, yes, December 9th is first clinic, second dose, and so we're still going on. In my slides, we included there.
Are you gonna have clinics out on the east side like you did in the past? You've had them in Williamstown, Richland, and all over. Are you gonna continue that process?
It depends. It depends, and depends on local needs, and depends on our capacity, and it depends on realistically is the volume also we needed to consider, because most recently I got a request from Constantia, and the Constantia actually say most recently not fair, and we got a request in September, and we monitor the whole county, and Constantia was one of our places we want to go, because they're remote there, and they don't have a pharmacy, local pharmacy there, and we know their difficulty, and we try to arrange it, but before we can arrange it, we found out, oh no, so those booster coming and the school coming, and we have to give up. And so we still continue monitor county's needs, and if we need a yes, we will do. And also go to local. Another thing is really over the past 2 months, and for this homebound population, and we did about 200 or over 200, and so local convenient access is not our top priority now, because these local people, they homebound, and we already delivered their booster dose third shots there. Okay. So this is, and also we work with this OPWDE disabled population, and there needs it.
Any other comments? All in favor?
Aye.
Opposed? Motion carries. Report.
Okay, report, and this is county case report, and I just want to point out here, yeah, and this up to date yesterday, and yesterday we have 92 cases, and before that we have a few days low, and yes, it's harder for me to say why is the low. Probably holiday, less people go there to testing. It's possible. So So this is our current situation. Oh, no, it's
You got it.
Yeah. This is our current situation, and I think I put into slide.
It needs to be turned on.
Okay. And our phone bank is still busy, and this phone bank is still play its important role to reach to community. And phone bank is, I always call phone bank theme, and the themes keep changing, and sometimes school, and sometimes yes, quarantine, isolation, paperwork, and our phone bank still play important role for this rural community. And I talk about these cases, and I didn't check after Thanksgiving, but pre-Thanksgiving, and we look at the school case remain at 30%, around 30%, and the school testing positive. And another thing is, yes, our collaboration with Plus Sky Urgent Care and the testing in November before Thanksgiving, we tested about 650 samples, and especially very good. And because this Plus Sky is at the northeast corner, so they have a mobile van, and they, Tuesday afternoon they put at CCC in Fulton, and Thursday afternoon put at Oswego High School, and really meet most populated areas needs. And before Thanksgiving we reviewed, and every Tuesday, Wednesday afternoon they collect over 40 samples each afternoon. So this collaboration works, and also this collaboration will pay at the state allows to pay at the school testing grant, right? So not to spend county's money or APA money here. So this is our testing. And this is our vaccination activity, and I think, yes, you're familiar with this tape graph. And November, as of yesterday, we already tested, set up 23 clinics. And total population, if we put it together, here's 5. We will, yes, I think we will keep it going up, and probably at 600. And the actual how many doses we deliver, I have not put it here yet. And I expect, yes, we did 4 schools, and every Wednesday afternoon booster clinic, and we can conduct like 90 doses. So added together, I think November it will be at 600 or above. So this is our vaccination efforts. Did I answer your question here? Yes. Okay. And next slide is our vaccination coverage. And here, vaccination coverage, and this is based on CDC's report. And I compare with last month, and I see, yes, we gradually we're increasing. And the reason I more follow up with CDC, not to follow state, is because state put us as fully vaccinated at high than here, 55.5, and for 3-4 weeks never change a bit. But actually, yes, I was expecting they change, because we vaccinated these young kids, and their data not reflect, and the CDC reflect. And when I redo this table and I saw every number updated from last time, November. And so this is more, I think, CDC probably more accurately reflect our improvement. Like I remember, like probably in October here was 52 something, and we increased, and CDC is more quickly updates, and you can see, but still, yes, CDC not include 5 to 11 years old yet. Their format is still older format. It started 12 years old. This is my answer. Okay.
Well, I'm not crazy about it, but that's what it is.
Yeah, it's a slowly increasing.
Do you have any, how do we compare with like a county that's very similar to ours in population, like Jefferson County? We're within 1,000, 2,000 people of each other.
I didn't specifically compare to Jefferson County, but I did look at some rural county, and if you look at, and about a week, 10 days ago, I can tell you we are fully vaccinated 12 years above 54, and some county lowest is like 40 something. So comparatively, yes, Oswego County not at the bottom, and don't listen to street say, because on the street I heard so many times Oswego is the worst in immunization and highest in disease COVID infection rates. No, I didn't honestly, I didn't follow this vaccine rate very closely, but at least I can tell you 7 days, 10 days ago when I look at it, yes, we're not the lowest. About the infection rates, no. Like last Sunday, 2 days ago, and our county, 60 positive cases every 100,000 population. And some counties, they have a few over 100, and many 70, 80. So if you let me rank, Oswego County probably are around the 10s or after 10s, like 11, 12s. So sometimes, yes, street room, I just frustrated how to tell people they don't think about Oswego is the worst. Oswego doing well, really. Sure, we can do better. We should do better, but doing well. All right. Okay. Okay, let's talk about other diseases. And it's fun to talk about other diseases. And first, let me talk about Lyme disease. Lyme disease, and look at data and Lyme disease, and here I very specific. Lyme disease case investigated. I'm not talking about it totally, because state, since 2018, state only used to we investigate each case, because the case is so many, and we cannot handle. So state started 2018, say they assign cases for us to investigate, and last year we investigated 31 cases, and this year already over 60 cases. Lyme disease is a big issue, and so I think that yes, this is a free service, and I try to promote hardly, and try to promote it very hard. And last week, tourism, yes, they sent out a press release, and this is a free testing service.
Yeah, I just want to point, I got a tick on me 2 weeks ago,
Yeah.
and I sent it in because I'm used to you telling us to send it in, and it tested positive, and I called my doctor, and he said, we don't even send them in anymore because they all come back positive, so if you get a tick, my personal doctor said they don't even care because they're all have the disease.
Yeah.
They haven't had any negative ones come back, so I guess they don't really care about this test so much anymore. Is that true? That's what my doctor told me.
I don't believe every sample is positive. And Oswego County and my data not updated. Okay, and from April last year when they started this service till March this year, and Oswego County tested positive is about 40%.
Oh, really?
It's very high, but not every tick is positive. And another thing I 100% understand because doctor responsible for patient, you as individual, you don't need to send. I agree. But me as public health worker, I want to promote it, and so we can know where is the ticks and how many ticks percentage-wise positive, and we can educate the people, help people prevent tick bites. That's why I promote it here, and this is a free test, and conducted by Upstate University, and you send it to them and email them, and they will give you results. So this is really started. I came here 2012, and when I came here, I saw the newest data was 2009. In 2009, how many cases positive throughout the county? 5. 2019, before this COVID started, and my preventive team, they're doing a great job, and I asked them, because the state not give us just, 2019 probably we tested 40 or investigated 40 cases, and I said, no, I don't care how many investigated. I wanted to know how many lab tested in Oswego County positive, and they literally go paper by paper and give me a number, shocked me, 249. It's a big issue. It's a big issue.
Not as big as the 100% increase in syphilis.
Oh yeah. Now let's talk about the syphilis. Now talk about the syphilis. Yes, last year 1 case, and this year 8 cases so far. And December probably will add 1 or not add 1. We are lucky. And I want to put it here. It's really yes. This if you think about where money goes, and for health department, a lot of money goes to syphilis too, and a positive case, each one get 1 or 2 shots, not shots, medication, and the price from $90 now over $400, and sometimes yes, we need to treat their sexual partners, and it's a lot of money there, and but yes, I think we try very hard to do this sexual transmitted diseases, and sometimes yes, it's difficult, and gonorrhea, yes, sexual transmitted disease, and we are doubled, and hepatitis C, and similar to last year. And last thing I want to talk about here is this rabies prevention. And the rabies prevention, I want to put really Oswego County does a great job, and over these years, and we have our environmental team and investigate each mosquito bite, and like Erie County, they don't do investigation like us. Oh, you scratched by your cat and you bit by a dog, and just yes, go to get the shots to prevent. And this could cost one shot. And I remember when I came here, 2014, 15, and one shot sent a bill to me was $2,800 for a shot. And then we didn't take it. And what we do is really, after exposure, our investigator investigate the situation and then make a careful decision and to see whether they needed to get a prophylaxis or not. And I remember the peak is we had the 2016. It's a peak. Our county prophylaxis 61 cases, and every year now go down. And this year I look forward like it's around 30. Last year 34. This year a little bit above 30. And because this service is state law, it's a local responsibility.
We had 30 people that had to get treated?
Yeah, 30 people get treated. And we every year we probably get close to 200 this kind of events. So I think these are all my presentations.
Doc, I got a question. Could you go back to your screen now?
Okay.
Syphilis, gonorrhea, and hepatitis C, sexually transmitted. Do we have a collaboration with the schools as far as their education for preventative? And you're not going to make these kids saints by any means, but
yes, we do. And this was, I think, probably 2017. And at that time, a local doctor called me and, Chin, you need to look at this teenager. I said, what's happened? And she was very angry. I still remember. And I gave her medicine, and I don't know where she put it, and tell her classmates and her peers, I'm fine and still sexually active. So after that, yes, we work with school nurse and put a press release, and this situation tapped down, I should say. And at the school education, OCO hospital, Oswego Hospital, they have health educator at the school. We do not do it. We do overall. And at each school and OCO and the school, Oswego Hospital, they have health educator at the school. So what we did was really, yes, send out the press release and communicate with the school nurse and OCO and let them enhance it. So what we monitor is really, we look at the age. And currently, this case, and it's not to go down to this young age. And we look at, yes, mostly is 24 to 46. Sure, the highest probably 70-something.
You don't think educating the kids at a younger age would benefit them down when they're promiscuous in school, let's get real. And, to break the cycle, and I know it's a tough cycle, I get that. But if you instill certain values and ideas and education in a younger person, there's a good possibility that at least will be in the back of their mind as they carry through in their life.
Yeah, and this sure, as I said, this was several years ago, and when we work with OCO, and the OCO expresses their frustration, and because at that time, probably now still they have, and they have van deliver condom to school, and some school not allow the van to their school property, And so they have to, yes, I meet you cross the street and advance there and give you condom.
They've come a long ways compared to where they were when I got on this committee. Years ago, there was very strong resistance from the schools to allow any talk of this in the schools. And we're not there yet because the schools control that. We don't. We can't tell them, look, I'm sorry you don't like it, but we're coming in and doing it anyway. It's the school that makes that decision. Even the college has come a tremendous round from being somewhat resistant to being fully engaged in trying to make sure that the education is there, the condoms, whatever is needed. But there's still school resistance on this with a lot of parents. Nope, you're not doing that with my child, and that's the end of the discussion.
Can I add?
Yeah, go ahead.
Since COVID-19, our educators in our preventive department really has not been able to focus on areas that need focus. That's why, another reason why the restructure is so important, is so we can get out there, do the education with the schools, get back into the schools. We used to do scrubby bear, hand washing with the schools. We haven't had time to do that. Even brushing your teeth, how important that is. There are so many key areas that we're missing out on within the schools because of our COVID response that we have to do and committed to.
Well, people die of syphilis and gonorrhea, hepatitis C. I mean, that's a given.
Yes, absolutely.
So, I mean, let's not pick out one over the other because who knows what the percentage is?
Absolutely.
I don't know that. I'm not a medical person. My knowledge of the medical world rattles around the bottom of Finwall.
And we can do more education and outreach with the appropriate staff.
All right. Are we going to talk about because I got a question when we get to his program or, things we discussed with him.
Well, first of all, I just want to comment that your expressionism, I hope they never take you off this committee. What else you got? Anything?
No, that's all.
Okay. The discussion of expanded health department and services is pretty much reserved for caucus at this point because we presented it there and it's not really a committee conversation at this moment. We're going to rediscuss that and take a look at that. I appreciate your concern of it.
Well, I just want to know what the hell an epidemiologist or whatever they are does because we just look at it 3 times. We're looking at it in his reorganization.
Well,
we got tons of fight on it.
You saw a perfect example of what the comment was made, and that's the only thing I'll refer to, as he said. We don't have the data. We don't have a way to get the data. Well, we don't have it because we don't have the people that can do that. He's our epidemiologist. So.
Is it Fauci one too?
I don't say that name publicly.
He is one.
He is one, yes. Yes. So, that it? Anybody got anything else? Quick meeting. Can I have the appropriate motion?
Well made.
All in favor?
All right.
Thank you.